These lungs are really squished. There we go, I'm squished.
Oh.
So this is obviously your right because it has 3 lobes, right? Mm-hmm. 3 lobes, 1, 2, and 3.
Sorry.
So when you're looking at a human lung, so can you turn the torso model around? Okay. So the smallest lobe is on where? Is it on the top or the bottom when you look at the human? It's on the bottom. Okay, it's opposite in sheep. Their smaller lobe is on top, and their bigger lobe is on the bottom. Does that make sense? All right. So here's the heart over here, and I'm just gonna. I'm sorry, Kirby.
Okay.
You know, I will forewarn you. You might want to scoot back a little. I'm really not trying to. So this is like part of the mediastinum, right? Where the heart sits with fat, and here's the heart. I know. I'm just trying to cut some stuff away. All this is is the mediastinum. This right here, this thick, darker. This is your diaphragm. Yeah, your diaphragm, but the diaphragm. Okay. So I'm going to trim some of this away so we can kind of look at it a little bit closer, all right? This out of the way. And this is the trachea with, oh, what do we got up here? So quiet. Can someone like talk or something?
No, we just want to hear the fat cutting off.
Could be that What's that? I know. Alright, so this, when you're looking at it, it's just like this, alright? In a sheep. So the heart is anterior, right? The lungs are posterior. So this would be the posterior side of the lungs. This would be the anterior side, okay? Just so you kind of understand. You feel like, all right, well, if this is anterior, then the right lung should be on the right, right? And here's your 3 lobes. So that's how you know it's the right lung, and this is the left one. Okay, does that make sense? So what is the trachea made out of? What the tissue is it made out of? It has cartilage in it, but what's the epithelial tissue? Not that you're going to see it on this, I'm just quizzing you. It's what? Wow. What epithelial tissue is
Columnar,
Alright, good job. Okay. So you have your trachea that comes down and then branches off into the bronchi. So will you remove the lungs there and the heart? Alright, so you see how your trachea comes down and it branches off to the left and the right? Yes, the light blue, you see, with the cartilage in it?
Oh, yeah.
So the primary bronchi, right? Those are your primary bronchi. So when we go to cut off the lungs, you should be cutting through your primary bronchi. This is sometimes why we use lungs that are already cut, because you can actually pull it out and look at stuff. But this is your primary bronchi right here. It's really large. You can't miss it. Okay? Primary bronchi. Smaller lobe's always on top, right? Yes? Yes. They're like, sure, if you say this. Yeah. This is really close. Yeah. Alright, so when you are looking, you have to be able to identify pulmonary arteries and pulmonary veins on the dissection. I'm just trying to trim away so you guys can see better. So what's different about the artery and vein in the lung than is the rest of the body?
Artery carrying the deoxygenated
Right? So it's opposite. And as far as the type of blood they carry. So oxygenated is carried in the vein. Deoxygenated is carried in the artery. When we're talking about the lungs. Okay? It's flip-flopped. But still, when you're trying to identify, the artery still has a much thicker tunica media. So it's going to be a much thicker vessel. The vein's going to be super flimsy. It's going to have a very flimsy wall. Okay? So you need to be able to look at these up close. You guys aren't going to be able to tell if I'm just recording. I'm just letting you know right now, okay? Another thing to realize is, all right, what lobe is more superior when we're talking about the sheep lung. It's a smaller lobe, right? So that's superior. The pulmonary artery is also more superior than the pulmonary vein, and it's also above the primary bronchi. Okay, does that make sense?
Mm.
I know you guys, so you have your primary bronchi here, okay? Is there a probe in there? So I'm not poking this with the scapula. Thank you. All right, so you have your primary bronchi up here. Between this vessel here and this vessel here, this is much flimsier, okay? Here has a much flimsier wall, right? Because veins do. They have much smaller tunic medias. So your pulmonary vein is down here and your pulmonary artery is here. So we basically can put little dots in here and you have to be able to tell me if this is a pulmonary artery, the pulmonary vein, or the primary bronchi.
Hmm.
Yes? Understand?
Yes.
So a big thing is that the artery is much thicker. The vein, the walls are really flimsy. All right? They're very flimsy. So you have to be able to tell the difference between that on a dissection, and we'll ask you. All right? We will also put it out and ask you about the lobes. All right? Obviously, this lung isn't the best one to ask because it folds up. All right? But we'll have nice lungs that kind of fold out so that you can see the different lobes. But we'll also, lay out a lung and we'll ID, this and ask you to tell, like, what lobe it is. So if I asked you what lobe this is, what would you tell me?
Superior.
Superior lobe of what lung?
The right.
No, you're right. It's the left. You need to be able to tell me if it's the right or left lung, too, in your answer. Okay, don't leave out the right or left side. Okay, you have to be able to tell the difference. Sorry, flinging stuff again. And then, what else do you guys have to know? You have to know the hilus? Hilum, is that what they call it? Okay, so that's just this region here, this whole region where the primary bronchi and the vessels go into. This is considered the hilum.
Mm.
Okay? And what else do you guys have to know? The diaphragm I showed you was over here. It's this thick, nasty stuff. Ugh. Right here, this is the diaphragm. It's the outer layer on the lung. We could just be like, yep. All right. Let me see if I can cut this one off so you can compare between the left and right. And then, so you need to also know the fissures, which are you have horizontal and oblique, right?
Not the dissection though.
Just dissect it. You don't?
I think
Just on the model? You don't? Okay. So there's not. So that's all you have to know on the dissection. That was it. All right. Well, there you have it.
There's the one that cardiac whatever.
The what? Cardiac notch.
Yeah.
So here you can look again. All right. Here's the smaller lobe. All right. Superior, middle, inferior lobe. All right. You guys might want to get gloves on and play with these so that you can tell the difference. I'm just going to let you know that now. Okay. This is your primary bronchi. All right. When we're talking about the pulmonary artery and vein. This is your artery. It's thicker. This is your vein. It's very flimsy and thin.
It's bigger on the left side.
Right.
That's the left side. That's the right side.
Choose the right lung.
This is the right lung.
Oh, it's like
The lung is bigger? Is that what you're saying?
I mean, no, the.
The bronchi? It's just the way
Yeah.
I cut it.
Okay.
I cut part of the trachea off in here.
Okay.
Still should be flimsy.
Well, yeah, when we're talking about the pulmonary vein, it's very flimsy, all right, and the artery is thicker, all right, and harder, all right. So I suggest that you guys at least put gloves on and kind of play with the lungs and look at them. You guys can do them together, but you can definitely see the three lobes, right? You have your superior, you have your middle, and you have your inferior. Remember that it's opposite. Sorry. It's opposite in a human, so don't confuse it. If we ask you, we can ask you the lobes on the model as well. Remember that it's opposite on the model than it is the sheep lung. I know it's really mean. Okay, so if you're talking about fissures here, all right, technically this would be your horizontal and this would be your oblique, but I guess we're not going to ask you that on this one. So make sure you can identify it on the model, all right, as far as the horizontal or oblique fissure. Does that make sense?
Yes.
Does anyone have any questions about any of this? Do you want me
Can we
to?
go over those lobes one more time?
Okay.
This is
So
right
superior.
bottom.
This is the middle, and the inferior on the sheep is very large, very large. The superior is very small, but the middle one barely looks like a lobe. Okay?
And
It's
how?
like in between. Sorry.
What's what?
The what is this? The inferior you said, or the superior?
This is the
What's that?
superior. It's just part of this lobe.
Okay.
Okay? It's just part of this lobe. What were you saying?
How like did you compare it for human? How is it opposite again? Like
It's just the other way. So this would be inferior, this would
So-
be middle, that would be... I'm
Okay,
sorry, this would be
so-
superior, middle,
so
inferior.
the superior is larger in a human.
Yes. If
Okay.
you look at the model. Where's the lung? But just we hold one up. Alright, so that's fine. See if you're looking there.
Okay.
See how the top the superior most superior lobe is much larger? And if you look at the inferior it's much smaller. Alright?
Okay.
It's opposite in a human.
Well,
Alright.
sheep are like this, so it's gonna be.
Yeah, you have to sheeps are on
Why
all
are-
fours.
Is-
Sheeps are on all fours.
Okay.
It's kind of confusing when you're trying to compare a human. Put the human on all fours, I guess. But as far as the lobes go, that's just. I'm sorry, that's just how it is. All right,
Can you go over the arteries in the other one? Or,
the arteries.
yeah.
So you have your primary bronchi. Your pulmonary artery is up here, closest to the smaller lobe, right, the superior lobe, and then your pulmonary vein is more inferior to the artery. All right. Now you have to understand this is why it's really good for you guys to look at these, because we could do this, and I could ask you about this vessel up here. You better not say pulmonary artery because you're going to be incorrect. Okay? That's why it's really important to understand, all right, if I'm looking at this is a much smaller lobe than this one. This is a much smaller lobe than this one, so this is closer to the large lobe. It's the pulmonary vein, all right? This one is closer to the smaller lobe. Sorry, bigger lobe. This is closer to the smaller. This is pulmonary artery. Does that make sense? So pulmonary artery is closer to the smaller lobe. Pulmonary vein is closer to the larger. So,
And that's always even in human.
we're not going to ask you on that one. I want you to. I know this is super confusing, and I wish this was a real anatomy class where we actually had human stuff to work on, but we don't. So, in your picture, the pulmonary artery will be closer to the superior lobe, and the pulmonary vein will be on the bottom. I believe that's what it is. So, all right. I mean, I think that's all the structures we went through them all, right?
I think so.
It's not too bad. The lung really isn't that bad. The biggest thing is not getting the pulmonary vein and artery mixed up. Primary bronchi sticks out like crazy. All right. Make sure you can count the lobes. I put on gloves and play with this stuff. I'm just saying it will be easier for you to identify. She's like,
Primary